Hi, everybody. Welcome into Pharmcast for the community. I'm your host, Dr. Tim Brown, as always, sponsored by UGA's College of Pharmacy. As we go into the summer months, I want to tell you guys, we're going to take a hiatus in July. I'm going to take a break, just a breather for the month. We'll be back in August talking about vaccines, in particular, talking about getting us geared up for the fall with both influenza vaccines and discussing where we are with the COVID vaccine and what that means when we use them together. I think we're going to be looking at a guest host coming in from the community. I need to confirm with her, but Dr. Ashley Hannings, who works here at UGA, is a possible guest for that. And I'm going to try to woo her in to come talk to us because she's great about discussing vaccines and how it impacts us in the community. But in the meantime, if you've not stepped outside lately, I think we'll all say that the heat has really gotten to us in the past 2 weeks. It's been amazing how we've grown and started thinking about vacations again as the masks have come off. Matter of fact, Memorial Day weekend, I'll call it the gateway to people actually trying to seek sun and fun. And because of that, we thought what better way to discuss how to keep you safe than talk about sunscreens and sunburns. And Dr. Adeboye is here with me today. Welcome so much. Thanks for coming on board.
Thank you, Dr. Brown. I really appreciate being here to talk with you.
When you and I first met, I was just surprised to find out what you do for a living, not because it's not important, because I don't think a lot of people realize that pharmacists work in skincare or dermatology. So tell me a little bit about you and where are you from? What's going on? And if I'm not mistaken, you went to school here in Georgia, didn't you?
Yes. So I am a clinical pharmacy specialist here at Emory Dermatology. And like you said, dermatology is definitely a unique setting for pharmacists. I will say Emory, our pharmacy department, is very unique in that they provide different opportunities for pharmacists to specialize in these various clinics. Like you said, I am from Georgia. I went to Georgia State University for my undergrad, and I also then went to Mercer College of Pharmacy for pharmacy school. And of course, I stayed on with Mercer, continuing my residency program. And this was also partnered with Rite Aid Pharmacy. So definitely, I have been here in Georgia for some time and have been happy to stay on with Emory as far as my clinical practice.
Very nice. Now, how long have you been working in dermatology?
Yeah, so I joined our practice last October, and so it hasn't been quite a year yet, but I will say I have been exposed to various different fields of dermatology, not only cosmetic, but a huge part of my role contains in treating and caring for patients with inflammatory skin conditions. I know you'll be thinking inflammatory skin conditions, so what does that mean?
Yeah.
When I say that goes into commonly plaque psoriasis. So you'll see a lot of advertisements for specialty medications, of course, Humira, Cosentyx, and also Tremfya. These are all specialty medications that are used to treat conditions like plaque psoriasis. I also care for our eczema patients with atopic dermatitis and a more rare inflammatory skin condition known as hidradenitis suppurativa.
Oh, now that's a big one. Hidradenitis suppurativa. Oh, good.
Yes, I know.
I think that when you talk about these aspects, a lot of people think, okay, dermatology or skincare, Botox and making myself look pretty. But there's another side other than the cosmetic side. And you talked about that a great deal. So when you're working there in the office, who are you working with? I mean, I'm assuming that when you're taking care of these patients, it's a team effort.
Yes, definitely a team effort. And for our patients here at Emory Dermatology, a lot of our patients are being referred from private practice, so from dermatologists out in the community, because these inflammatory skin conditions usually require a greater level of experience and background outside of topical medications that we may apply to the skin. Our dermatologists will often prescribe oral or systemic treatments to better care for our patients with plaque psoriasis. So when it comes to that team, it's not just me, pharmacy. We have our providers, we have a physician assistant, and a whole squad of nurses here.
So when you're talking about choosing these medications, these are some expensive medications. So you're guiding the team in trying to find the right medication that works for whatever's going on, and then help guide a bit with people getting access to those medications too.
Yes, access is the biggest part of my job. Not only does it come with clinical management as far as providing counseling and additional information on these medications, but like you said, these medications are very expensive. And I know none of us want to break the bank just to treat the conditions that they have. And as far as the cost, it can range from several thousands of dollars to tens of thousands of dollars. So I have a great medication access specialist that is partnered with the Emory Specialty Pharmacy that helps my patients navigate our access for these medications. So whether it be copay assistance, patient assistance programs that we help enroll patients in, these are all avenues that we help our patients with even before getting started with their medication.
Wow, I bet they love the fact you've joined their practice because you make it easier to sort of figure out what's going on.
Yeah, and the turnaround time. So no provider wants to see that they recently saw a patient in clinic and then 3 months down or the next follow-up appointment, the patient unfortunately still hasn't received their medication. That's a long time to be without care. So having a pharmacist that's a go-between all of these specialty pharmacies and the clinic definitely helps and is a new practice model that I hope other institutions will also adopt.
Very nice. Now, we talked about sort of inflammatory skin conditions, but I think the other aspect that, I want to talk about today is when I go to my dermatologist, I mean, if people can't see this podcast, I am pale, redheaded, green-eyed. So I get my skin looked at every year, sort of in a screening mechanism. Mm-hmm. Is that what happens I know you're taking care of these inflammatory. Does that also happen in your office? Do they screen folks looking for things that could be wrong with the skin and trying to catch them early?
Oh, yes, definitely. Mondays are my in-clinic days, and I see patients not only that do have these inflammatory skin conditions, but patients that do come into clinic for their annual skin exam. So when it comes to annual skin screenings, I think you mentioned just being fair-skinned and being, going to your dermatologist and, getting different moles or whatever mark checked. All of these are typical, practices that a dermatologist needs to review when evaluating a patient's skin, and is definitely fair game when it comes to annual skin screenings.
So I guess the question, and I'll tell you guys, I lifeguarded in my youth. I know you're thinking, oh my gosh, really? And I used to burn at the very beginning of the summer, and then I was so happy I burned because then I would tan afterwards. Mm-hmm. But over the years, I've read that the number of burns that you have add up, mm-hmm. and that it actually puts me at increased risk for having skin problems, because it's not just I got burnt 3 summers ago and now I'm fine. It's every summer I got burnt. It all adds up over the term of my life. Is that true?
Yes, I will say that is definitely true. And it is even more paramount if that early sun exposure or those early severe burns were before the age of 18. So say, for instance, us being in our youth, we're constantly out in the sun, having fun. Sure. And then we, with age, we get experience and additional knowledge, and we understand that we need to limit our sun exposure. Even though we've limited our sun exposure, that sun damage is unfortunately still there and does still pose us a great risk. So when we're mentioning that is a good point, because it helps us understand what our risk factors are when it comes to skin cancer. So you being fair-skinned, our patients with blue eyes, red hair, and then those of us that tan or also burn easily. And of course, those who did have that early sun exposure at an early age, those are all risk factors for skin cancer. And then when we talked about when you're coming in for your annual skin exam, when you're showing your dermatologist those moles and marks, anything that could be weird or off-looking or atypical, as we call it, those are all, unfortunately, risks for skin cancer.
And they have to be monitored, right? I mean, it's not like I pop in this year and they see something kind of weird. They may have me come back more frequently than a year, especially if you have those risk factors you were talking about.
Yeah, no, it's definitely not a one and done scenario. We want to see generally the general population each year. We do the American Cancer Society does recommend to receive an annual skin exam each year. So when it comes to patients with a greater risk, or maybe that even had a prior skin cancer, that frequency does increase. So in clinic, our general recommendations are for patients who had a new skin cancer that first year, we do want to see you on an every 3 to 4 month basis. And then depending that everything is fine and no reoccurrences, that screening may drop down to every 6 months. And continuously, if you're still doing great, that will then drop down further to every year. But I do recommend for our patients and our listeners to establish a relationship with a dermatologist, or if you don't have access to a dermatologist, a primary care provider, to discuss any concerning spots. So if there is any detectable skin cancer, it is detected early and treated early.
I think it's a great time to say, and I'm going to say this because my dad's a farmer, and I'm going to say for all those people out there working in the sun every day, and I know it sounds crazy because we never go to the doctor unless we're really sick, right? That you reach a certain age, you need to have a skin physician or a skin provider so they can look over your skin and make sure you look okay, even if it's just once a year. And if you're like me, maybe more frequently. And I say that because a lot of people don't realize their exposure to the sun that they get every day. And then honestly, we don't think about it until something bad happens. And this is preventive, right? This is like going to get your annual wellness visit. This is an annual skin wellness visit.
Yes. A lot of us, forget that our skin is actually an organ. So just like how you would, maybe for us women, we would go and get visit our OBGYN, or like you said, an annual wellness exam by our primary care provider. Do remember that your skin is an organ, and constant exposure to the sun or other harsh chemicals does pose us a risk for, skin cancer and, other, different things such as sunspots, freckles, and of course those pesky wrinkles. So, it's something that we definitely want to add to our requiem of doctors.
Now, you talked about skin cancer, and obviously there's data showing that if we protect our skin, we can decrease our chance of skin cancers. There are a couple of different types of skin cancers. So what are those? So people kind of have an idea of what they should be looking for, if they're examining their own skin.
Yeah, so we have 2 various forms of types of skin cancer. It's broken into non-melanoma skin cancers and then also melanoma skin cancers. Non-melanoma skin cancers are actually the most common form of cancer. And those are the moles and the atypical rashes and marks that we see that are usually typically treated early. These are known as basal cell carcinomas and squamous cell carcinomas. Like I said, if we do get them seen and treated early, they are often curable. And again, they are the most common form. I think the CDC reports that about 4.3 million patients in the United States are actively receiving treatment for these non-melanoma skin cancers.
Wow. I didn't realize it was that many. Holy cow.
Yeah, it definitely is alarming because, the link between the sun and skin cancer is so strong. So it is a very much a high number that we need to be aware of.
And I guess within the melanoma is it's the serious, well, I guess every cancer is serious, but melanoma has some worse outcomes associated with it.
Yes, definitely. Melanoma is the most serious form of skin cancer. It's not as common as basal cell and squamous cell cancers. When I say it's not the most common, it actually accounts for 1% of these cancers, but it is the deadliest. So it's something that we definitely want to be aware of and take the necessary preventive measures. The American Cancer Society gives us, data that there's going to be 100,000 new patients diagnosed with melanoma this year.
Wow.
And so when we take that actual 100,000, 7,000, unfortunately, of those patients are expected to die from melanoma.
Wow.
So it definitely does have worser outcomes, poor prognosis when it comes to survival rates. So I'm glad that we're definitely having this discussion. So we're being more aware of how we can prevent any of us from being exposed to this type of cancer.
No, it's interesting. And I want to tell folks out there, if you're kind of like, well, does this mole look suspicious or not? You can actually Google, and there's great little things that the dermatology group put up that show you how to look for the margins of your moles and how they look and those kinds of things. We can't do it here today because it's just difficult to hit everybody's type of mole and freckle, but you can Google that and look it up, and it'll give you the guidelines of how you know if something looks weird. And I say that in the nicest way, but if it looks weird, find somebody to look at it that's professional to give you an idea of what's going on. Because I think, as you point out, that if we catch this early, many times we can have a significant impact if it's caught early. And that's true for a lot of cancers, and that's true for skin cancer as well.
Definitely. I would have to agree.
Well, and I think the other side of that coin is let's just talk about responsibility for a second. Maybe if we just didn't get burnt so often, and I own that, then maybe I wouldn't have this worry, right? Or other people out there. So I think there's this discussion that sunscreen is only for people who are light skinned or Caucasian, or as you talked about, have fair skin, light eyes. But that's not true, right? Sunscreens can be used by everybody because everybody's at risk for having damage to their skin.
Yes. Everyone is at risk for having sun damage. Melanoma is not specific to any type of race, color, or skin type. We all have risks for, unfortunately, being exposed to melanoma because it goes hand in hand with our sun exposure over time. So the more we can reduce that sun exposure, we can reduce not only melanoma, but then also our chances of basal cell and squamous cell skin cancers. Like you said, there is a misconception that people who may tan easily or people that would have darker skin types may not have that same risk factor for skin cancer. But ultimately, any change in the color of our skin, whether it be from sun exposure, is a sign of a type of damage. And we want to prevent that as much as possible. So when it comes to those with darker skin cancers, because of that misconception, we're often don't see a dermatologist for annual skin exams. Oftentimes we don't get those skin cancers detected early. So patients with darker skin, honestly, when they are diagnosed, it's usually at a later stage. So understanding our risk, that it's non-discriminatory when it comes to skin color, type, or appearance, the better, because at that point, our dermatologists would be able to detect these early skin cancers earlier and have a greater cure rate.
So take-home message. This isn't just for people that are fair skinned like me. It's for everybody. They should get their yearly skin exam. Yeah. I guess some would say, and I'm one of them, let's say, okay, well, I can't be in the sun because if I burn, it's going to increase my chance. But I really want to look pretty in the summer.
Yeah, don't we all?
So what if I chose a tanning bed? Is it safer than the sun, or like how do I know about the danger of that?
Yeah, that's definitely a good question, because it's intuitive to think that, a tanning bed, it's not actually coming directly to the sun. So therefore, the tan that I get from the tanning bed is probably safer. It's actually wrong.
Oh.
The exposure from the tanning bed is also ultraviolet rays. And these are the same rays that we, get exposed to with sun exposure.
Oh.
And even though you may not see an actual burn, the sunspots, freckles, and the wrinkles that we often do get from the tanning bed also increases our risk for skin cancer. And I think about 20% of patients, 20% of the American population does develop skin cancer from this type of sun exposure.
Wow. So the ray inside the tanning bed, that's a different, it's the same ray from the sun, but it's like UV, is it UVA in the tanning bed? So how many rays are there from the sun that we have to worry about? Because it sounds like there's a lot going on here.
Yeah, there's definitely a lot of rays that we're being exposed to. Even though we are not able to see these rays, our skin is constantly being exposed to it. So these UV rays are classified as either ultraviolet A or ultraviolet B, or better known as UVA and UVB respectively.
Got it.
And when it comes to UVA, that's the one that makes up the majority of the rays that our sun gets exposed to. They're able to penetrate into the deeper layers of our skin.
Oh.
They're even able to go through glass itself. And this one is the most one that's present that causes much of the tanning or sun damage. And then when it comes to UVB rays, it's not as common as UVA, and that rate is about 5%, but it actually causes the most destruction to our skin. So UVB rays, that's the one that eventually leads to melanoma and other types of skin cancer.
Got it. So even though I think I'm going to the tanning bed to be healthier, the UVA still leads to cancer. The sun gives me UVA and UVB and can lead to cancer. So how the heck do I protect myself from these rays? I mean, obviously don't get in the tanning bed. I mean, that's just kind of a common sense approach to option A. But option B, I mean, I have to walk from my car to my building. I do like to go outside and work in the garden. And, you know, between you and me, I do enjoy a little walk on the beach every now and then. So how do you protect yourself against getting those burns or I guess the sun damage that might occur?
Yeah, I mean, we definitely can't stay hermits and stay inside the house, you know.
Yeah, I think this last year has proven that, right?
Yeah, from time to time, we do have to go to the grocery store, like you said, head out to work. But of course, you know, it's the summer. We all want to have fun. We all want to go outside and do outdoor activities. But one of the primary ways that we can protect our skin from the sun is by wearing sun protective clothing. So I know that sounds like a big word because sun protective clothing, what does that mean? But when I say sun protective clothing, you know, that comes into wearing like a broad brimmed hat, wearing those nice, you know, shades that you have, sunglasses, wearing long sleeves. And then even there are companies that actually make clothing where its fabrics and its threads actually have ultraviolet protective factor.
Right. I've seen that.
Yeah, or UPF. There's several different companies, definitely, you know, Googling, you'll see a host of companies that have developed ways to reflect those sun rays off of the skin. And also just wearing loose fitting clothing. You know, the misconception is that lighter colors are better in the sun, but actually darker or brighter colors will reflect the sun's rays off. And denser rather than sheer fabrics are also ways when it comes to, you know, choosing what you're going to wear when you're going outside. But of course, you know, I understand, you know, wearing a long sleeve, you know, shirt in this hot sun is not always ideal. So other ways is just, you know, in general, try to reduce your travel between the hours of 10 and 4 p.m. When it is extremely hot, especially if you have a greater risk and you're not actively doing, you know, outdoor or sun or, you know, swimming activities are all helpful techniques.
So garden in the morning, maybe walk on the beach in the evening. Yeah, that kind of stuff. Yeah. Okay, that makes sense. So obviously we live in Georgia and it is hot. So we're going to still have exposed skin, right? I mean, let's face reality. I'm putting shorts on. I'm going to have a t-shirt on. So how do I choose to cover my skin if my clothes aren't going to do it for me? We got to use sunscreen. I have to tell you, Dr. Adeboye, when I was a kid, we used to put baby oil on ourselves to fry in the sun. I mean, I know we have come so far since those days of skin protection, but you know, those old days of just having a product that was lotion after you had been in the sun to hydrate the skin. Now we have products designed to block this UVA and UVB. But how do I go in the grocery store aisle and choose these? Because I was in there over the weekend just to look around to see, because I knew we had this discussion. There's a lot of stuff to choose from.
Yes. I mean, I'm sure all of us have been down the grocery aisle and seen, you know, that sun care aisle, and it can be very overwhelming and daunting as far as what do I actually pick? But like you said, you know, gone are the days where we're actually using tanning oil or baby oil before going out into the sun. We definitely want to block the sun's rays. because we do understand what our risk factors are now for skin cancer. So that comes into choosing a proper sunscreen to protect our skin. And when it comes to choosing sunscreen, it's used by everyone. Remember, we said how skin cancer does not discriminate against, skin or the type of skin that we have. So using a sunscreen before going outside is the next recommendation outside of sun protective clothing.
Got it. So sunscreens, UVA and UVB, the UVA is a newer thought from what we were talking about earlier. How do I know if my sunscreen takes care of both those ultraviolet rays? I mean, do they all take care of it, or do I have to look for special wording or something on the package?
I would say definitely look for the special wording because we want to choose a sunscreen that's first broad spectrum. So when I say broad spectrum, one that covers both UVA and UVB rays, because they go hand in hand. Even though UVA rays are more common, UVB rays is actually the one that's more destructive and unfortunately leads to melanoma.
So the SPF I see on that bottle, does it apply to how good it works for both rays? Or be honest with you, SPFs confuse me because I've seen SPFs that are 5 all the way up to like 90. And I'm like, how do I know? Because let's face reality, I'm not spending $40 for a bottle of SPF 90. I mean, that's cost prohibitive. If I have a family of 5, how am I going to slather them up with that costing that much money? Like, how do I know how to choose those SPFs, and does that really even matter?
Yeah, so that's next on our list. Not only does it need to be broad spectrum, is that we need to look at the SPF number. And SPF, it actually stands for sun protection factor. Like you said, it does go from various ranges, from not only 5 to 100. So we might be thinking, which one do I actually need? So when it comes to that numbering, it breaks down into various categories, about 4 different categories. Okay. So low, like you said, SPF 5, that's from SPF 5 to 10. And then when it goes down to medium, it goes from SPF 15 all the way to 25. When it comes to SPF high, that's classified as 30 to 50. And then for those very high numbers, greater than 50, 100, like you said, that would be a very high category. Now, the American Academy of Dermatology recommends a sunscreen of at least SPF 30. So that goes into the high category. Okay. So I wouldn't recommend the SPF 5. And then us thinking about the high category, what about the very high category? Because definitely, doesn't that make more sense? Let's just slather on the very high category and I'm good and I'm protected.
Done. I've got the Teflon of sun perfection, right?
Exactly. Exactly. Top shelf versus low shelf.
Right.
So actually, I will say that is another myth. Using the difference between SPF 30 and SPF 100 is very, very minimal. So let's break it down. So an SPF of 50 filters out about 98% of the sun's rays. Okay. Now, an SPF of 100 filters out 99% of the sun's rays. So we've got SPF 50 of 98%, SPF 100 of about 99%. And then when it comes to SPF 30, it filters out 97%. So
I only get 2 percentage points more if I go from 30 to 100.
Yes. And so I don't know, maybe if you're a type A person, I don't feel like spending that extra $40 on the very high SPF 100 is worthwhile.
So the 30 is what they recommend. That gets the 97%, which sounds like and that's for everybody, right? So even if you even if you tan easily, you still should be looking at 30 to protect your body for the most part.
Yes.
So I think the other question I always have is, all right, I can put this on, but how long does it take for it to work? I've seen people standing by the pool trying to spray their kids, like holding that upper arm and pulling that kid back from the pool and like just trying to douse them down with a spray of sunscreen. It doesn't look really effective. that way.
Yeah. I mean, we're dousing them down with that spray. And then, of course, that kid is just going to hop right into the pool within minutes later.
Right.
But again, it all goes into technique, right? So not only does the sunscreen need to be broad spectrum, at least an SPF of 30, but then we need to be considering how we're actually using it.
Okay.
So when applying sunscreen, the best practice is to apply it 30 minutes before going outside, because we want to let it marinate, just like the best cooks always marinate their food actually before prepping or cooking. So please follow the same policy.
So 30 minutes before I actually have to be in the sun, I need to put my sunscreen on. I need to get ready in the hotel room or in the house before I head to the beach or the pool. Okay.
Yes. So add it to your general skincare regimen. So once you're, getting ready outside of the shower, go ahead and put your sunscreen on over the entire body, not just the areas that you think you may be exposed to.
Okay. So there's been a big push lately. So there's lotions and gels, and the spray is so convenient.
Mm-hmm.
When I use the spray, do I just spray it and I'm done, or do I need to do anything else?
Yeah, so spraying sunscreen sprays are very convenient. But honestly, there is a misconception as far as like how we actually need to use those sprays. Not only does the spray need to be at least 6 inches from the skin, we actually need to apply 2 coats.
Oh.
And even though the packaging may not say you need to rub it in, you must rub the sunscreen in, because that ensures that the sunscreen is being absorbed and binded to the skin.
So that's the same thing as me just putting on I'm not trying to say one's better than the other, but people choose spray. That way your hands don't, you don't have to worry about all that.
Yeah.
But it sounds like you still have to rub it just like you do the lotion.
Yeah.
And I love how you say 2 coats, like we're painting them, 2 coats.
Yeah, front and back.
I would tell you, I was at the pool and I watched a parent spray their kid and the wind was blowing. And, I don't think people realize that aerosol is probably not getting to that skin pretty easily if the wind's blowing everywhere. So it's hard to do this inside too, because sometimes it just stinks and you're trying to spray in your bathroom and all that. Also, I watched them try to spray the kid's head.
Oh, wow.
I'm gonna guess that it's not good to spray that stuff directly into the face or on the head. Is that fair?
Yeah, that is definitely fair. And especially for a lot of our children who have higher rates of asthma, a lot of the sunscreen sprays definitely contain a lot of irritants that may be harmful to our breathing, aggravate our asthma. So you can only imagine that same child that was doused in sunscreen spray is now coughing and not maybe enjoying the best time by the pool.
Well, and between you and me, yesterday I read an article in the USA Today that there's some discussion that some of the products that are on the market, somehow benzene has gotten into them, and the FDA is having a discussion on this. And if you guys want to look at this, you can Google it. Mm-hmm. But there's not a lot of data I can talk about. But it seems like if there's benzene in those sprays, it'd be easier to breathe in this benzene, which, by the way, benzene is not something you want to breathe in. Right. So check with your local pharmacist or your primary care provider about your sunscreen products. There's a long list out there, but just sort of know what you're looking at, because something you have in your cupboard could have this benzene in it. And if you're trying to spray it, I worry about that a little bit more than applying it to like a sunscreen lotion. Mm-hmm. But I just want you to know. And then you talked about kids. How young? When should we start putting sunscreen on our kids? At what age?
Yeah. So, of course, right now that we're kind of settling down, or the pandemic is a little bit winding down, and a lot of us feel more comfortable traveling. I know I've seen a lot of families out by the pool, going to different destinations. And when I say the entire family, I'm talking about our infants and also our toddlers. The first recommendation when it comes to protecting these little ones from the sun is to protect them first with sun protective clothing. And that should be the general recommendation for all babies and infants younger than 6 months.
Okay.
Now, once we get to that 6 months age, parents should feel free to go ahead and apply sunscreen just in the same manner to the entire body. And it has to be, again, an SPF of at least 30. So I don't want it to be that, our babies shouldn't have shouldn't have or receive sunscreen, but try to keep it to where they're of at least 6 months of age and older.
Okay. Now, we were talking about face and earth thing earlier. They make sunscreen just for the neck up for babies and adults, right? And some people ask me, well, do I have to buy both? Because, again, you're doubling your cost. Do I have to buy both? But the ones for the face are pretty specific because the skin on our face is a little bit different than the skin on our elbows, right?
Yes. And, the same lotion or, all those serums that you apply to your face, you're not applying it to your body. And that's because our skin on our face, it's much more sensitive, more prone to irritation. And that's why we have sunscreen, not only for the face, but then also separate for the body. Because the sunscreen for the face contains less of those irritants. And if you can think back to those, sunscreen sprays, a lot of them do possess harmful alcohols. So alcohols can be very drying to the skin. And in the same manner that you would apply that sunscreen spray with all those alcohols and then head out into the sun where the skin is then dehydrated, not only you might have, sunburns, but then you also be predisposed to wrinkles because of that lack of hydration.
This is going to be the vanity of me. I'm like, cancer, but wrinkles. Oh no, now I'm worried. I know, isn't that horrible? It's funny you bring this up. So we've got broad spectrum, SPF of at least 30, that if you do use the spray, it's 2 coats and you still have to apply it with your hands. Don't spray it around the head and the face. Use face sunscreen specifically. And then I guess we've been talking about the pool and running around, but do these last? I mean, I want to tell you that I put mine on and it lasts all day long because I don't want to stop my fun when I'm at the barbecue or the pool. But I get the impression you're going to tell me that's not the case. They don't last all day.
No, it definitely does not last all day, but I definitely wish there were some sunscreens that, could definitely last all day. I mean, they would be making definitely a lot of money.
Yeah.
But they do have to be reapplied. So if we're not actively sweating or in the water, the recommendation is to reapply every 2 hours. But if we are in the water, we want to make sure that we reapply our sunscreen every 40 to 80 minutes.
Holy cow.
Yes, and that is this in the same respect if our skin is then dry, like heading out or toweling off after being out in the pool. So it definitely does become something that we have to keep in the forefront of our minds to constantly reapply. The earlier, the better.
So the FDA changed the wording on the bottle. What's the 40? What does the bottle have to say to tell me I need to reapply it 40 minutes in water, after water?
So the wording must be that it is water resistant.
Okay.
So previously, you would see manufacturers that would say that sunscreen is either sweat proof or waterproof, but there really isn't any truly waterproof lotion, spray, or gel. And that's the reason why we have to reapply, because sunscreen, it's only good for as long as it's actually on the skin. So once we head out into the pool, the sunscreen then starts, getting off the skin. So once you're coming back out of the pool, that sunscreen is unfortunately not there as much any longer.
Got it.
So we have to then reapply. And again, so if we are actively sweating or in the water or coming out of the water, it would have to be reapplied every 40 minutes.
So every 40 minutes for water resistant. And then I love this. Is it very water resistant? Gets you 80 minutes?
Oh yeah. You get the extra 40 minutes. So
if you want to spend the money, you got the SPF of 30 and the very water resistant buys you 80 minutes. So about an hour and a half for you have to reapply it.
Exactly. So the very water resistant then gives you that extended time frame of 80 minutes. I will say it's kind of hard to find those.
Yeah.
And more often you'll see the general as water resistant, which does get you the
So the rule that as a lifeguard, we were told is when we call a break for the kids to be out of the pool for that, 15-minute break or whatever it is that you usually call every hour, that the mom, dad, caregiver, the kid themselves should reapply their sunscreen during that break. But if you're laying on the beach and no one's blowing the whistle for that break, you need to know that if you turn over every 30 minutes in the sun, you need to reapply sunscreen. I'm just trying to give people tips out there. And then if you're working in the garden, I think this is the most difficult one. But if you stop to get some water because you feel thirsty from working outside, apply sunscreen when you stop for hydration. That way you can tie it to something. And that means you need to keep the sunscreen outside. Can't keep it in the bathroom. You got to keep it in the garage.
Keep it in the garage, keep it readily available and visible. So you're, like you said, tying it with an activity definitely helps provide those reminder tips.
Yeah, I think to myself when I'm outside working and I get so caught up that if I stop and get water, I should stop and put more sunscreen on my face. And if I'm, just those exposed areas, again, because I worry about burning after hearing all this stuff about the exposure I've given myself over the years. Yeah. Wow. So, okay, I'm going to go back. Sun protective clothing when you can. Even if you do that, you still need to come in with a broad spectrum. You need to look at the date on it and make sure that it's not expired. I think it's 3 years that the FDA gives something. It needs to be water resistant, SPF of 30, 6 months of age and older can use them. Specific sunscreens for my face because it's different than the rest of my body. And I need to apply these 30 minutes before I'm going to be exposed to the sun because this needs to stick on my body before I walk outside. And because my body is not sleek like Teflon, the water takes it off and I have to reapply it every 40 minutes. I need to figure out how to do that. And if I'm not doing anything with water, I can reapply every 2 hours. Like if I'm out sitting on the cabin, having an adult beverage with my friends, I would reapply every 2 hours for my barbecue. Okay. All right. Wow. Those are a lot of rules. Holy cow.
It is a lot of rules, but definitely rules that, saves lives and also, protects us not only from skin cancer, but then, like you said, a lot of us, we're vain. Those sunspots, wrinkles, freckles, a lot of that is seen less in the skin if we regularly apply sunscreen.
So, Dr. Adeboye, we've covered a lot. We talked about pharmacy and derm. We talked about cancers and screenings, inflammatory skins. Then you gave some really great tips on how to go into the store and find a product. If you had to leave our listeners with some pearls today, what pearl would you leave them with as we go into our summer months with no mask and we're all extremely excited about the lake and the pool and just working outside and being around people and going to barbecues? I can't wait to fully enjoy summer this year.
Yeah, no, definitely. I will say, don't ever underestimate the power of sunscreen in that bottle that you have. We talked about skin cancer and the two main forms. Remember, prevention is key. Not only if we apply sunscreen, but if we see a dermatologist or at least a primary care provider regularly that examines our skin, we have a great chance to either get those early stage skin cancers detected and cured. And just moving forward, sunscreen applies to everyone. So not only if you're fair skin, but someone of a darker complexion like myself should regularly apply skin cancer because, again, skin cancer does not discriminate.
Yeah. So people from everywhere should be wearing sunscreen.
Yes.
Wonderful. You have been I just love hearing you talk because seeing a pharmacist in this realm is awesome. And then also hearing how you work with your patients to help them get the care they deserve is incredible. My hat is off to you. I think you're breaking barriers for pharmacy care and pharmacy models. And gosh, I love to see that, especially here in Georgia.
Thank you. Thank you so much. I'm very happy and appreciative of the role that I'm in. Like you said, this is a unique setting for pharmacists, and I hope it opens doors for other institutions to expand the various roles that pharmacists have and have the opportunity to be exposed to. So again, thank you, Dr. Brown, for inviting me to this discussion. I hope I was able to dispel some myths and misinformation on sunscreen use.
Dr. Adeboye, you did an amazing job. And for those listening to us, please keep in mind, July, we're going to take a little bit of a break. In the meantime, tune back in August for vaccines with PharmCast for the community coming to you from UGA's College of Pharmacy. I'm your host, Dr. Tim Brown. As always, go and be safe, enjoy the summer, and we'll see you soon. Thanks again.